Thank you for that introduction. I am a pharmacist of 20 years, currently the Chief Pharmacist at National Pharmacy, so I look after 46 pharmacies across 3 states, leading them to deliver vaccination services to the community, including to children. So as we've talked about today already, childhood immunisation remains one of the most effective public health interventions that we have. Today I'll be discussing vaccinating children in the community pharmacy setting, beginning with a high-level overview of what vaccination in pharmacy looks like across Australia, and then focusing on how this model applies specifically to children. The emphasis will be on access, safety, governance, and how pharmacy-based services integrate into the broader immunisation system. So immunisation has transformed child health outcomes. We know this. They prevent diseases that once caused significant morbidity and mortality. These benefits extend well beyond individual children, protecting families and communities through herd immunity. Maintaining these gains depends on high and sustained vaccination coverage throughout childhood, from infancy through to adolescence. And public health success often looks invisible. It looks like healthy children and families going about their daily lives and diseases that we no longer see. Public health isn't about needles or clinics. It's about outcomes, about protecting everyday moments, and I'm sure that that is something that we're all really passionate about here. So I think we've seen this chart a few times already today. Despite the overall success of Australia's immunisation programs, challenges remain. In some age groups, vaccination coverage has levelled off or declined, and missed or delayed vaccinations are becoming more common. Importantly, these gaps are not usually driven by opposition to vaccination. Most parents want to protect their children, but face everyday barriers. Finding appointments that fit around work and school, limited clinic hours, travel and access issues, or managing a child's fear and anxiety, especially after a difficult past experience. National data shows that childhood vaccination coverage has not yet returned to pre-pandemic levels, and delays at key childhood milestones means that some children remain unprotected for longer than intended, increasing their risk of vaccine-preventable disease. Even short delays can matter. These findings highlight the importance of accessible, trusted vaccination settings that fit more easily into family life. Improving access and timelines and supporting positive vaccination experiences are essential to maintaining strong childhood immunisation coverage. And this is where community-based settings, including community pharmacies, can play a valuable supporting role alongside existing services. Vaccination in community pharmacy is now an established part of Australia's immunisation landscape. Pharmacists have been vaccinating since 2014, initially starting with influenza and expanding across the board. Pharmacists undertake structured training, work within defined clinical governance frameworks, and deliver vaccinations that are appropriately documented and recorded in our national systems. Importantly, pharmacy-based vaccination is designed to complement, not replace, existing providers such as general practice and public immunisation clinics. They help to reduce missed opportunities and delays. Community pharmacies are among the most accessible form of healthcare in Australia. They're widely distributed across metropolitan, regional and rural areas, and are frequently visited by patients and families in their everyday lives. This accessibility, combined with high levels of trust in healthcare professionals, makes community pharmacy a really valuable setting for delivering preventative health services, including vaccinations. Research consistently shows that trust remains strong, and community pharmacists' frequent and informal contact with families places them well to support confidence, engagement, and timely vaccination. As I said, community pharmacies are among the most accessible healthcare settings in Australia. You see on the screen there an image of a 24/7 pharmacy. There are 4 24-hour pharmacies in Adelaide, which is where I'm from, and I'm not suggesting that we vaccinate at all hours of the day and night, but it does mean that we have extended coverage. So community pharmacies are widely distributed. They're visited frequently, up to 18 times a year by families, and often open outside of those traditional clinic hours. This accessibility makes pharmacy a valuable setting for opportunistic vaccination, particularly for families who may find it difficult to attend appointments during standard clinic hours or who do not routinely engage with general practice or immunisation clinics. Importantly, pharmacy-based vaccination is designed to complement those services already available, not to replace them. And convenience is a key strength of pharmacy vaccination. Our extended opening hours, we take walk-in availability appointments, and flexible appointment options help families fit vaccination into their everyday lives, especially for working parents and carers. And when we think about vaccination delivery, access is the starting point. Improved access creates opportunity, which in turn supports timely vaccination, better coverage, and stronger public health outcomes. These principles underpin vaccination in community pharmacy and are particularly relevant for children and families. Pharmacy-based vaccinations support a whole-of-family approach to immunisation. Children can be vaccinated at the same visit as parents or caregivers, whether for seasonal influenza, routine boosters, or vaccines recommended for travel. Travel health is an emerging area of practice for community pharmacy, with pharmacists increasingly supporting families to prepare for international travel. Providing vaccination and advice in a single accessible setting helps families protect children before travel, reduces the need for multiple appointments, and supports timely, coordinated care at the household level. And if we look at influenza, it provides a useful and very familiar case study. Despite being a vaccine-preventable illness, vaccination uptake among children, particularly those under 5, remains low. Children are frequently exposed to influenza in school and childcare settings and can easily pass infection onto family members and others in the community. They're also obviously at risk of complications such as pneumonia or hospitalisation. Improving influenza vaccination in children helps protect not only that child but their family, reduces them missing school, missed work for parents, and also obviously has an impact on protecting vulnerable people in their lives and the community as well. So to touch on flu mist, an emerging innovation in childhood influenza vaccination is flu mist, a live attenuated influenza vaccination delivered as a nasal spray. So we know that it's being used extensively overseas and very newly registered for use in Australia. From a public health perspective, its significance lies in its acceptability. Needle anxiety, we know, is a real barrier for many children and families, and offering a needle-free option may help improve uptake. We know that it has a well-established safety profile, with mild and transient side effects being most common. So pharmacists are authorised to administer flu mist across all states, with age eligibility and scope of practice varying by jurisdiction and aligned to local regulations. From a system perspective, pharmacy delivery supports equity by providing additional convenient access points for vaccination, particularly during peak influenza seasons. Importantly, like I've said before, this model means that we're not competing with general practice or other immunisation services, simply providing another option for parents to get their child immunised. Several Australian states have introduced or expanded publicly funded influenza vaccination programs, including flu mist. While most programs currently focus on children between the ages of 2 and 5, Western Australia is going a little bit further than that and offering that for up to 12 years of age. So these initiatives reflect growing recognition of the importance of improving influenza vaccination coverage in children and reducing access barriers through funded, accessible vaccination options. Moving on to talk more broadly, safety and clinical governance are central to any paediatric vaccination program. Childhood vaccination is a safe and well-established healthcare intervention when delivered within appropriate governance frameworks. In community pharmacy, this includes mandatory training, pre-vaccination screening, preparedness for adverse events, and clear protocols for management, reporting, and escalation when vaccination needs to be deferred or referred. And safety in vaccination is not just about the vaccine itself, it's about the systems that support its safe delivery. These safeguards are essential to ensuring high quality care and maintaining public trust across all immunisation settings. Informed consent is a cornerstone. Pharmacy-based vaccination requires consent from a parent or guardian with clear, understandable information about the benefits and risks of vaccination and the opportunity to ask questions. Where appropriate, involving children in an age-appropriate way can help build cooperation and confidence too. Equally important is recognising and respecting distress or refusal, ensuring families feel heard and supported, and knowing when to pause, defer, or refer to another service helps build trust not only in the vaccination encounter, but in the health system more broadly. These principles apply across all vaccination settings, including community pharmacy, and are essential to maintaining confidence in immunisation programs. So needle fear and anxiety are very common in children and a normal part of development. Importantly, the fear and anticipation before vaccination is often greater than the brief discomfort of the injection itself. Evidence shows that the way a vaccination is delivered can strongly influence a child's experience, their memory of the event, and their willing to engage in healthcare in the future. A calm environment, supportive communication, and appropriate involvement of a parent can reduce distress and help build trust. Practical strategies include preparing families in advance, using honest and age-appropriate language, and offering simple distraction, such as a comfort or distraction tool, or letting children watch a favourite show, like Bluey, while involving parents as active partners in the process. Just as important is recognising when a child is too distressed and respecting refusal. Sometimes pausing or rescheduling is the safest and most appropriate option. National research shows that barriers to childhood vaccination are often practical and experiential rather than driven by opposition to vaccines itself. Child distress, anxiety, and previous negative experiences can influence whether families return for future vaccinations. And this really reinforces the importance of creating that positive, supportive vaccination experience, where accessibility and trust can be leveraged to build confidence and support ongoing engagement with immunisation services. We've talked a little bit today about myths and misinformation. Parents today are exposed to health information from many different sources, including social media, online forums, and conversations with either parents at school or in childcare. These sources often reflect personal experiences which can be compelling and emotionally persuasive, even when they don't reflect the broader evidence. Importantly, research consistently shows that most families are not opposed to vaccination. They're trying to do the best for their children while navigating a really complex and sometimes conflicting information environment. In this context, your trusted health professionals play a critical role, and pharmacists, like other immunisation providers, are well placed to support vaccine confidence by listening respectfully, acknowledging concerns, and providing clear, evidence-based information in a language parents can understand. Some of the misconceptions parents have include vaccination causes autism, natural infection is better than vaccination, they're full of harmful toxins, or my child is healthy, so why do they need to get vaccinated? Addressing these misconceptions is not about correcting or confronting parents. It's about building that trust over time, using consistent and supportive communication, and helping families to really feel confident in their decisions. Because when parents feel heard and respected, they're more likely to engage positively with immunisation services. So to close, childhood immunisation remains a critical public health priority. Australia has strong immunisation programs, but we know that gaps in coverage and delays still occur, leaving some children vulnerable. Importantly, most families want to protect their children, and when vaccinations are missed or delayed, it's often due to practical challenges: access, time pressures, convenience, or previous experiences. Community pharmacy can play a really valuable supporting role by making vaccination easier to access for families, working alongside general practice and other immunisation providers to reduce missed opportunities and delays. Creating positive vaccination experiences, building trust, and communicating clearly with parents and children are central to supporting vaccine confidence and ongoing engagement with immunisation services. We look forward to vaccinating more children in the future, looking forward to consistency across our great nation, Australia, and reducing some of those differences that we see between the states and territories.
Thank you. So we've got time for a couple of questions. I've got one online, which is pharmacists might be easily accessible, but not every pharmacy is giving vaccines. What percentage of pharmacists are giving vaccines? And then a question there.
I don't have an answer to how many pharmacists are actually providing vaccinations, but it's actually part of the undergraduate degree for pharmacists now. So rather than needing to do another course after you've already graduated, that's actually built into the course. So more and more you'll see that service being offered through your pharmacy, but give them a call or jump online. Lots of them have got online booking systems, so you'll be able to tell if you can get an appointment.
John?
Bec, interesting talk. I'm the first to agree that GPs are busy, but fragmented care means that you actually make sure that all of the players in the system are kept up to date. And it's my understanding, talking to a number of pharmacists, that they really leave it up to the patient to say, should you let your GP know? Now, I know that reporting to the AI is going to help that, but a lot of the GPs would see these people regularly, and I think fragmentation of care would be actually assisted by referring and letting the GP know that this child has had the vaccine, so they can update their records. They'll wait because your team have given the vaccine, but they can actually see what's happened. More importantly, it's kind of a bigger issue of how do you do that in terms of what your coverage levels is, so that it's great to hear all about this with access, but at the end of the day, it'd be really important to know how many people were approached in a pharmacy and what level of coverage did you get, so that you then got some data to reflect on the various strategies that you've talked about how you're going to improve it, so that whether, you know, it's one thing bigger than an issue, so that access is a big issue, but there may be other issues that you might not be aware of, and measuring the coverage and seeing how that's changes will give you some insight into that.
So it's absolutely mandatory for vaccinations to be recorded in the air, and the software that pharmacists use is integrated with the air, so that's really seamless for us. There's also secure messaging within that platform as well, so the pharmacists can communicate back to the GPs, because I agree, you know, we're one part of the patient's healthcare system, and we all need to collaborate together, because that's when our patients get the best care.
But the problem is they're not doing it. They're not letting people know, and while the AIO is active as a way of actually checking it, it would be just a courtesy. If you send someone to a physio or an OT specialist, you get a letter back with information. It would be very helpful to the pharmacy with fragmentation of care to communicate this back to the GP, even though they may have a variable role in coordinating it, but it would be very helpful for them to know.
Absolutely.
All right, I think point taken. Just, I've got a question online. Is the nasal flu going to be available in pharmacy? What price? And I think you've covered it, privacy and anaphylaxis covered by your training, but availability of the flu medicine then?
Yes, it will be available in community pharmacy. The price will be up to what you negotiate with the supplier, but it'll be available. So a lot of the states are doing funded programs where maybe you might get the vaccination for free in that cohort 2 to 5 or 2 to 12 if you're in WA. But in South Australia, for instance, we can actually charge an administration fee because that's not funded under the NIPVIP program.
Great. Thanks for the presentation, Bec. In terms of pharmacies who are registered to deliver NIP vaccines, 4,800 out of the 6,000 are registered to provide NIP vaccines, so it's pretty good coverage around the country.
About 75-80% or something.
Yeah. Great percentage. My question is, and I'm asking you to respond on behalf of all community pharmacy across the country, of course, my question is not about the safety of how community pharmacy can deliver those vaccines to children, but how does community pharmacy convince, maybe the government to open up the NIPVIP to under 5s, and how does it convince families and parents that what has traditionally been vaccines administered somewhere else can be done safely in community pharmacy?
I think great questions. So as I said, I'm from South Australia. Last year, the state government, relatively late in the season, actually funded vaccinations for flu for children under the age of 5, so 6 months to 5 years. They actually, it's a messy program because it's not actually funded by the usual mechanisms, which means there's a lot more admin to actually reconcile all those payments, but it demonstrated that they recognise that community pharmacists have a role to play in vaccinating flu for that age cohort. So I think we're taking steps there, and bodies like the Pharmaceutical Society of Australia and the Pharmacy Guild, I have no doubt, are working towards NIPVIP being available for that cohort. Just a little bit tricky when some of the legislation across different states doesn't actually enable the pharmacist to administer to that entire age cohort. So steps in the right direction, we're getting there. And to your other question, I think, like I said, we've been vaccinating since 2014, starting with flu and moving on to a range of other vaccinations as well. And we've proven that we can do that in a safe and effective way. I think that pharmacists have really strong relationships with their customers and patients who come in to see them multiple times throughout the year, and so there's an awful lot of trust there as well. So, and a lot of these people have already been vaccinated themselves, maybe for flu or something else in the pharmacy setting, so they've experienced that and know what that looks like, and therefore I think that gives them a level of comfort to have their children vaccinated too. But then a part of that also is us getting out there and telling people that we offer this service and we can do it.
Well, you set down the challenge for you, so the Commonwealth is doing that, so the states need to do that as well. So thank you very much, Bec, for giving us your perspective. Thank you.